So over the course of having family camp, how did it evolve during those several years that you ran family camp? Robin?
So the first couple of years, it was the core group of clinicians and the camp staff, which we called the green shirts, and the administrative levels. And after a couple of years, we had the idea that we're getting tired and old. And, and we really, in the spirit of generativity, we really want other people to be able to do this. So it doesn't just sit with us, because we thought we had a really good idea, and we thought it was a workable opportunity. So what we did is we decided to have sort of interns. So we invited, for the first group, we invited some additional people who could join and be like co-counselors in our groups and in our family sessions. And that then evolved into really a much more formal training program where people would apply, and we would select people who would then, we had a core group of trainees, and the core group of trainees were not acting as clinical staff. They would watch what was going on. They would sort of be in the circle that was listening to how we talked about these cases and what we did with them. And we had almost a curriculum for how, what the training experience would be. And then some of those trainees came back another year as sort of resident staff and would do co-leading groups. And then that continued to evolve into the camp-based training program.
So what we realized and what we talked about in our situation room, our war room, is that we had an incredibly rich 5-day process, maybe 14, 15 hours a day, where all of us, Matt, Robin, me, other people that came in the first years, were interacting with families, and we could see different aspects of change going on, but we couldn't capture it all. And wouldn't it be such a wonderful idea if we use this essentially immersion training so that people could view, of course, with consent, the richness that we were learning from these families. We were, of course, using our expertise, but the families were also teaching us.
Mm-hmm. Mm-hmm.
Yeah, and I think that training began to shape the evolution of overcoming barriers, because we were having poor outcomes. Even though we put in, I think 18 hours was kind of a conservative estimate. Maybe it was more like 20 to 22 hours of work in the camp. But we would move these families. We would move these families from that stuck, intractable place. We'd get movement in kids reconnecting positively, and then we'd hear when they went back to their homes, they would slip back to baseline. So what we realized is, on the front end, we needed clinicians in the communities who were already working with these families, and not moving the ball, but were engaged. And on the tail end, we needed aftercare to be able to move these families back to. If we moved them here, we needed them to take them from here and move them forward. And therefore, whether it was Toronto, Canada, or Miami, Florida, where these families came from, because they came from all over North America, we needed to start having clinicians in these communities, not just clinicians, but judges who were more specialized and trained, attorneys who kind of could wrap their head around these issues and not just advocate for their prospective clients. And that became added impetus to have a training, specialized training. Because you can't get specialized going to conferences or listening to didactic training. We felt like immersion training would be so much more potent and valuable.
Mhm. And that shaped how we did camp. And as Matt said, how overcoming barriers evolved in terms of its mission and its identity. So after, I don't remember how many years, but after a few years, when we realized about what Matt described as the slippage that would occur, we then wouldn't take a family unless they had those resources in place when they left, because it would be a waste of their time and money to have this experience where there was growth and change, whatever that looked like per family, and then it would all slip back. So the requirements for what had to be in place for the families evolved because of what we were learning about both our process and how these families worked. And then we became much more focused on training at every level, the immersion experience at camp, but also training interdisciplinary. And that became a major part of our mission.
What did you see as being the available resources generally out there in terms of either mental health professionals, lawyers, or judges really knowing anything about the refuse resist dynamic? And you can crap on the lawyers, it's okay.
So I think just like everything else we talked about, there's a continuum. And so it's more nuanced than an either or. And we certainly had attorneys or mental health professionals or court professionals, whatever, who kind of knew what they were doing and what they were looking for. And we had others who were really wandering around not knowing, and then others who were potentially maybe a little bit more destructive because they were so aligned with their clients, and that can be attorneys and mental health people, that yeah, it was, we needed to educate a lot of people, not just the families, not just the mental health people, but the broader communities of the all forensic people involved.
Mhm.
And so did there then become a, sort of another outlet, so to speak, where there was some focus on education?
Yeah.
Totally. That's where we went. And we felt like we had a more of a longitudinal view of where things could go with these families. And I mean, we were learning every year. It's, every year there was more that we would understand and then try to integrate into our training. But we felt like we had a longer term view, so that we really felt like we knew what had to be in place up front, what a judge needed to order, how attorneys needed to treat these families and work together, how the mental health professionals needed to treat these families, because that treatment was often incredibly flawed, only because people didn't have the training and didn't have the understanding. So we felt like we could train in judges, lawyers, court personnel, and mental health professionals from the second a family walked in to the courtroom or filed a motion, I should say, to what were the possibilities on the other end.
Yeah, the camp was the last ditch effort to see if both parents could be meaningfully involved in their kids' life. It was, in the progression of these situations, it was kind of stage 4 cancer malignancy.
Mhm.
By definition, intervening earlier in and of itself was going to lead to better outcomes. So although the camp was an incredible laboratory for innovation, both because the challenges were there in their extreme, but also bringing together, you know, sort of the brightest, generated a tremendous amount of innovation. We wanted to bring the point of intervention earlier in the process, as Robin was saying, to judges who see these cases for the first time, to attorneys who are the gatekeepers of these cases. They see their parents, you know, first, to mental health professionals, and so our training became much more of the priority. The bang for the buck once a year of six families is pretty minimal.
Yep.
If we could use the camp as a lab and then shift our focus to training as many family justice professionals as possible, it just makes sense that would be a better mission for overcoming barriers.
And then we also felt like, well, we need to evaluate what we're doing. You know, we think we're making progress in these ways. We're hearing when people leave camp really positive feedback. We had, and so we got a researcher involved, Michael Saney, a professor at the University of Toronto, who began to do both pre-camp surveys and post-camp surveys. And so we had an understanding of the benefits of the camp experience, but we still didn't have a good sense from research, which is really the only way you can know about what happened in the long term. And so Dr. Saney did more evaluation of families, and we learned more from that. And yet, what is really so, I think, frustrating for all of us in the field, not just overcoming barriers, but all of us who work with these families, is there is not a lot of research on either the characteristics of the people who end up in these really entrenched, intractable places, or the interventions that may work for specific characteristics and family configurations. So that we're still on the really cutting edge of that.
So just to follow up with what Robin said, we felt we were really doing a great job with the families. We were getting positive satisfaction reports from the families, but we didn't know whether what we were doing lasted. And as Matt said, in terms of bang for the buck, which is your phrase, seeing 5, 6, 7 families a year, once a year, and not sharing that expertise and what we were learning, even though at that time it may not have been research-based, it's pretty hard to do. We felt like we wanted to share and learn, have people learn from us, and us learn from others in the field.